PTSD, post-traumatic stress disorder, can occur based on so many different experiences. A lot of times when people think of PTSD, they think of something severe, like a veteran and a veteran going to war and coming back and having PTSD. And that is definitely true in one of the examples of the most severe cases of PTSD. But people don't realize that PTSD can happen from all types of life occurrences. It can happen from relationships. It can happen, based on a trauma that you went through growing up. It can be the byproduct of bullying. It can be something like a financial crisis in your life where you lost everything. PTSD is really about holding on to a situation or event that you can't really let go of. Those thoughts are intrusive. You continue to remember the event or the incident, how it happened, when it happened, and keep reliving it over and over again in your everyday waking life and also while you're asleep. It's so intrusive that you can't even focus on the present moment. You can't be in the present moment, and you base so many things in your life because of the symptoms of post-traumatic stress disorder. And it's a very important treatment to have, and it's also sometimes difficult to recognize. And often, too often, it's swept under the rug, I think, when we're talking about the everyday things in life, like such things as relationships or other stressors that are happening in our lives. And as a result, a lot of people will end up avoiding that particular thing because they don't want to experience their PTSD symptoms. Sometimes that could be avoiding a relationship, or it could be avoiding venturing out from a business perspective, or for a financial reason, just because of something bad that had happened to you. So PTSD can be across the board a lot more varied in its presentation than we realize. And I think, for PTSD, it's one of those things where we do need different modalities of treatment. And if anything, PTSD has shown us that, things like meditation and yoga and other things, breathing techniques, visualization, imagery, so many other things out there really can help for PTSD. And I think once again, that's very important to see a practitioner to see whether or not there's something in your life, a life experience or an event that has affected you so deeply that you've kind of changed from it forever, and how to kind of get yourself back from that.